Hello everyone, today we'll explore an important and fascinating topic, diabetes. Grab your pen and paper, stay focused, and take notes as we delve into key details and insights that will help you better understand this critical subject. And now, let's begin. Diabetes mellitus, commonly referred to as diabetes, is a chronic medical condition that affects how your body processes blood sugar or glucose. Glucose serves as the primary energy source for your body's cells and is derived from the food you eat. For your cells to absorb and use glucose effectively, the hormone insulin, produced by the pancreas, plays a critical role. In individuals with diabetes, either the pancreas does not produce enough insulin or the body's cells fail to respond adequately to insulin. This leads to elevated glucose levels in the bloodstream, a condition known as hyperglycemia. Over time, high blood sugar can cause serious health complications, including damage to blood vessels, nerves, and vital organs such as the heart, kidneys, and eyes. There are three primary types of diabetes. 1. Type 1 diabetes, an autoimmune condition in which the immune system attacks and destroys insulin-producing cells in the pancreas. This type is usually diagnosed in childhood or early adulthood and requires lifelong insulin therapy. 2. Type 2 diabetes, the most common form of diabetes, characterized by insulin resistance. While the pancreas still produces insulin, the body's cells cannot use it effectively. Type 2 diabetes is closely linked to lifestyle factors such as obesity, sedentary behavior, and poor dietary habits. 3. Gestational diabetes, a type of diabetes that develops during pregnancy and typically resolves after childbirth. However, it increases the mother's risk of developing type 2 diabetes later in life. Additionally, there is a condition called prediabetes, where blood sugar levels are higher than normal but not yet high enough to be classified as diabetes. Without intervention, prediabetes often progresses to type 2 diabetes. Let's talk about the role of insulin in the body. Insulin is often referred to as the key that unlocks cells, allowing glucose to enter and be used for energy. Here's how it works under normal conditions. 1. After eating, carbohydrates are broken down into glucose, which enters the bloodstream. 2. The pancreas detects rising blood sugar levels and releases insulin. 3. Insulin binds to receptors on the surface of cells, signaling them to absorb glucose from the bloodstream. In diabetes, this process is disrupted. In type 1 diabetes, the body produces little to no insulin. In type 2 diabetes, insulin production may be normal or even elevated, but cells become resistant to its effects. This leads to a buildup of glucose in the blood, while cells remain starved for energy. Drop your thoughts in the comment section if you've followed us this far into the video. Why is early detection critical? Diabetes is often called a silent disease because it can develop gradually and remain undiagnosed for years. By the time symptoms appear, significant damage may have already occurred. For example, persistent hyperglycemia can damage the small blood vessels, microvascular damage, leading to complications such as diabetic retinopathy, eye disease, nephropathy, kidney disease, and neuropathy. It can also cause macrovascular complications such as heart attacks, strokes, and poor circulation, increasing the risk of amputation. The earlier diabetes is detected, the easier it is to manage and prevent complications. Simple blood tests, such as fasting glucose, HbA1c, and oral glucose tolerance tests, can identify abnormal blood sugar levels before significant damage occurs. If you've learned something from this part of the video, please comment below with your healthy fatigue management tips or questions. Let's talk about the 7 early signs of diabetes 1. Fatigue and excessive tiredness. Fatigue is one of the most common and early symptoms of diabetes, yet it is often overlooked. This is not the typical tiredness caused by a lack of sleep or physical exertion. Instead, it is a profound and persistent exhaustion that doesn't improve with rest. How can diabetes cause fatigue? In diabetes, fatigue occurs primarily due to an imbalance in blood sugar levels. 1. Energy starvation in cells. In individuals with diabetes, glucose does not enter cells effectively due to either a lack of insulin, type 1, or insulin resistance, type 2. As a result, cells are deprived of their primary energy source. This leaves the body feeling drained, even after consuming food. 2. Frequent blood sugar hypoglycemia can lead to fatigue. Hyperglycemia slows down blood circulation and affects oxygen delivery to cells, while hypoglycemia leaves the brain and muscles without adequate fuel. 3. Inflammation and hormonal imbalance. Chronic high blood sugar levels can trigger inflammation in the body, disrupting hormonal balances and leading to feelings of tiredness and lethargy. How do you differentiate fatigue from other causes? Fatigue related to diabetes is distinct in that it often occurs even when other factors, such as sleep or physical activity, are adequate. If you find yourself unusually tired after meals or throughout the day, it's worth consulting a doctor to check your blood sugar levels. Let's talk about a real-life example. Consider Jane, a 45-year-old office worker. She noticed that she struggled to stay awake during meetings, even after a full night's rest. After experiencing this for months, she consulted her doctor and was diagnosed with type 2 diabetes. Upon managing her blood sugar levels with medication and dietary changes, her energy levels improved significantly. If you've learned something valuable from this part of the video, we'd love to hear from you. Share your thoughts in the comments and tell us your favorite healthy ways to manage fatigue. Let's keep the conversation going. 2. Tingling and burning sensations in the feet. This symptom, medically known as peripheral neuropathy, is often an early warning sign of diabetes or prediabetes. It occurs due to nerve damage caused by prolonged high blood sugar levels. What is diabetic neuropathy? Diabetic neuropathy affects the peripheral nerves, those outside the brain and spinal cord. These nerves transmit signals between the body and the central nervous system. High blood sugar damages these nerves, leading to symptoms such as tingling or pins and needles sensations, often create a prickly or crawling feeling, usually noticeable in the hands, feet, or other areas, which can sometimes come and go unexpectedly. Burning pain, especially in the feet and hands, can feel like an intense warmth or a persistent stinging sensation. It may worsen at certain times, such as during rest, and can make simple activities uncomfortable or challenging to manage. Numbness or loss of sensation can leave the affected areas feeling disconnected, making it harder to notice touch or movement, which might affect daily tasks or routines. Now let's explore the measures to prevent and manage neuropathy. 1. Control blood sugar levels with prescribed medication, a balanced diet, and regular exercise to improve insulin sensitivity and overall health. 2. Make it a habit to inspect your feet regularly, looking carefully for any cuts, blisters, redness, or other injuries. 3. Consult a podiatrist for routine foot care. If you're ready to break free from tingling and burning sensations, share your thoughts in the comments. Let us know your best tips and ideas for healthy living. Let's inspire and learn from each other. 3. Frequent urination. Frequent urination, or polyuria, is a hallmark symptom of diabetes. This symptom is especially noticeable at night, disrupting sleep patterns and affecting overall well-being. The science behind polyuria: under normal circumstances, the kidneys filter glucose from the blood and reabsorb it into the body. However, when blood sugar levels exceed 180 mg/dL, the kidneys cannot reabsorb all the glucose. Excess glucose is excreted in the urine, drawing water along with it. This results in increased urine production. This osmotic effect draws water along with it, leading to a significant rise in urine volume as the body attempts to regulate glucose levels. Dehydration and increased thirst, polydipsia, creating a vicious cycle. What are its impacts on your daily life? For individuals with undiagnosed diabetes, frequent trips to the bathroom it disrupts sleep patterns, which can reduce restorative rest and lead to persistent daytime fatigue and low energy levels. It interferes with work or social activities. When do you seek help? If you find yourself urinating more frequently than usual, especially at night, and experiencing intense thirst, consult a doctor. These symptoms may indicate high blood sugar levels. Thankfully, blood pressure doctors are simply waiting to hear from you. 4. Skin changes. Skin changes are often overlooked but can provide important clues about underlying insulin resistance or diabetes. Acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by darkened patches of skin with a velvety texture, commonly appearing on the neck, armpits, and groin. This condition is a result of excess insulin stimulating the rapid growth of skin cells. It is often a precursor to type 2 diabetes and serves as an early warning sign of insulin resistance. Skin tags. Skin tags are small benign growths that frequently appear in areas where the skin folds, such as the neck and armpits. They are associated with higher levels of insulin in the blood. Importance of early detection. Both conditions indicate that the body is struggling to regulate insulin effectively. Identifying and addressing these signs early can help prevent the progression to diabetes. Excessive hunger or polyphagia is another common symptom of diabetes. This occurs when the body's cells are unable to access glucose for energy, leading the brain to signal hunger, even after eating. How diabetes causes polyphagia. 1. Inadequate energy supply. In type 1 diabetes, the lack of insulin prevents glucose from entering cells. In type 2 diabetes, insulin resistance has a similar effect. This leaves cells starved for energy. 2. Insulin overproduction. In early stages of type 2 diabetes, the pancreas compensates for insulin resistance by producing more insulin. This can lead to sudden drops in blood sugar, triggering hunger. 6. Blurred vision. Blurred vision is one of the most noticeable and concerning early symptoms of diabetes. It occurs when elevated blood sugar levels affect the structure and function of the eyes, particularly the lenses. How high blood sugar affects vision. 1. Fluid accumulation in the lens. High blood sugar levels cause glucose to enter the lens of the eye, leading to fluid retention. This swelling alters the shape of the light properly onto the retina. 2. Changes in the lens flexibility. Prolonged exposure to high glucose can make the lens less flexible, impairing the eye's ability to adapt to near and far vision. 3. Damage to retinal blood vessels. Chronic hyperglycemia damages the small blood vessels in the retina, a condition known as diabetic retinopathy. Early stages involve microaneurysms and fluid leakage, while advanced stages can lead to vision loss due to scar tissue formation or retinal detachment. Reversibility of blurred vision. In many cases, blurred vision caused by fluid retention improves once blood sugar levels are stabilized. However, long-term complications like diabetic retinopathy require medical intervention to prevent permanent vision loss. Recognizing the right time to seek professional help. If you experience sudden changes in your vision, consult an eye doctor immediately. Regular eye exams are crucial for individuals with diabetes or pre-diabetes, as early detection of eye problems can prevent irreversible damage. 7. Slow healing wounds. Slow wound healing is a significant symptom of diabetes and serves as a warning sign of prolonged hyperglycemia. This symptom is particularly concerning because it increases the risk of infections and serious complications, especially in the lower extremities. Why wound healing slows in diabetes 2. 1. Reduced blood flow. High blood sugar levels damage small blood vessels, impairing circulation. Reduced blood flow limits the delivery of oxygen and nutrients necessary for tissue repair. 2. Weakened immune response. Chronic hyperglycemia compromises the function of white blood cells, which are essential for fighting infections and cleaning wound sites. This leaves wounds more susceptible to infections. 3. Nerve damage. Peripheral neuropathy decreases sensation in the extremities, making it harder for individuals to notice minor cuts or injuries. These unnoticed wounds can worsen without proper care. Areas most frequently affected include: the feet are particularly vulnerable due to a combination of poor circulation, neuropathy, and frequent exposure to minor injuries or pressure. Untreated wounds can develop into ulcers, which may require surgical intervention or even amputation. Effective strategies for prevention and management. Check your skin daily, especially your feet, for any signs of injury or irritation. Maintain stable blood sugar levels to enhance circulation and support immune health. Consult a healthcare provider promptly for wounds that aren't healing to avoid complications. Do you have tips for managing slow healing wounds? Share your healthy living practices in the comments. Don't forget to like and subscribe to help us grow this supportive community. Understanding the bigger picture, the 7 symptoms, fatigue, tingling sensations, frequent urination, skin changes, excessive hunger, blurred vision, and slow wound healing are not isolated issues. They are deeply interconnected, all stemming from the body's inability to regulate blood sugar effectively. When left unchecked, these symptoms can escalate, leading to more serious health complications. Each serves as a red flag, signaling the need for prompt medical evaluation and proactive steps to manage blood sugar levels, safeguard overall health, and prevent the progression of diabetes. Thanks for watching. If you found this video on the 7 signs your blood sugar levels might be high helpful, don't forget to give it a thumbs up and share it with someone who could benefit from this information. Make sure to hit that subscribe button and turn on notifications so you won't miss out on more health tips and advice. Stay healthy, and I'll see you in the next video.